Guys, look at this question. Discuss management of accidental needle stick injury in a house surgeon during phlebotomy. So they're asking you about needle stick injury, NSI, and they're asking you how you will manage this in a house surgeon, that is an intern, when that person was doing phlebotomy, the person was drawing blood from the vein, right? So something has happened and this person has got pricked now. Okay, it could be from this needle, or even otherwise from a scalpel or anything. Okay, I'm telling you in a generic thing, and either this was self it happened, or somebody else was holding it and it happened. So basically what they are trying to ask you here is how will you manage. So the main things that you need to focus on are these three, that is the virus, human immunodeficiency virus, HIV, hepatitis B and hepatitis C. These are the three things that they are concerned. Okay, this is what you have to understand here. So you got the concept right, guys. So now let's look at the answer that you will write in the exam. See, when you look at the textbook, it says that if the source, okay, source is the person whom you were trying to do phlebotomy on. If this guy has HIV and he is not taking any antiretroviral therapy, okay, this guy, that time the risk of transmission is 0.3%. So this is the source, okay, this person is the source, and the source is not taking any treatment. He has HIV, okay, so that time the risk is how much? 0.3%. You got it right. Now let us move on to hepatitis B and hepatitis C. What the textbook says, let us see. Hepatitis B, the textbook says that they didn't give any percentage, but needle stick injury will do a horizontal transmission. Okay, so horizontal transmission means from person to person, right? So from person to person, like this, if it goes, this is horizontal transmission. Vertical transmission, it's from mother to child, okay, parent to child actually. But anyways, here we are talking about hepatitis B infection can happen because of needle stick injury. Now coming to chronic hepatitis C, here they have again given percentage, it is 3% risk. Okay, so hepatitis C seems to have a higher risk actually, interestingly, right? Okay, now let us get started with our answer. First of all, you define needle stick injury, guys, in the answer. You will say that this is an occupational hazard. And hence, as it is an occupational hazard in medical field, you should already have policies in place to prevent and handle this. Okay, so so prevention. First of all, prevention. Let us talk about prevention first. You should never recap needles. Okay, when you should not recap needles. You should just discard the needle. You should not go and close the cap again, because you should have the sharp objects disposal. Okay. You should, prevention also is training of the people who are doing all this. Okay, so training, you put training under prevention. Do not recap needles. Okay, then you should have gloves. You should wear gloves. You should have puncture resistant containers and very strong gloves. Okay, all this you should have. You should have infection control protocol. Okay, so did you understand prevention? Will you write? Very good. You understood 4 points in prevention. Now coming, what they've asked you is management. So coming to management, now the management will start. Okay. So first of all, let's talk about first aid, and then talk about the other points that you should write. Headings you should write are, you should do first aid, then you should report it, then you should do a risk assessment, that is you should check the source if that person is infected, then post exposure prophylaxis, if that person is affected, then what vaccination etc you will give to this person, post exposure prophylaxis, and then follow up and testing post all this. Okay, so these are the 5 points for 5 marks that they have asked you will write. Okay, so let us look at first aid. First aid is, first of all, you should not panic. Okay, and then you should remove those gloves, then you should wash it with soap. You should not squeeze it or anything and put some antiseptic alcohol and all. You should not put. Basically, you should wash it with soap, not squeeze it. That's, you understood. And don't put this finger in your mouth or something. Okay, and then if it is any mucous membrane or anything, then wash it again. Same thing. That's what they are saying. You can rinse it with normal saline also. Okay, so first aid is done. Then you have to, once you're done with first aid, you will report it. Guys, we are moving on to the reporting. So what you will do, you will report it. You will have some protocols. You will document the injury, who, whom, which patient, and what time, location, exactly everything. You will notify whoever has to be notified. You will notify them. You will notify the hospital infection control. Okay, and then they will come and do what they have to do. Okay, then what they will do the risk assessment. So whoever is the source, don't let him go away. keep that person there and identify the source. Okay, what is the age of the source, what is this person here for, etc, 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 and then you will take their sample, right, for examination, source examination you want to do. So are you with us? So what are you talking about here? Source. That person is there, no? That person you will have to test. Okay, on whom you are doing the phlebotomy or the surgery, that person's HIV status and all that. I'm sure you will have to take the consent and all that, and then you will get the HIV, HB, hepatitis B, hepatitis C, okay, HBV, that is hepatitis B virus, HCV, hepatitis C virus. All this you will get tested in that person. What and all you will get tested? HIV, hepatitis B, hepatitis C. Very good. You will get it tested. Okay. Anything else also strange, you can get it tested, I feel. Okay. Textbook is talking about only these three, but okay. Now let us go to the next heading here, post-exposure prophylaxis. So you will find out that this guy is positive, the source is positive, or you don't know the status of the source. For some reason, you don't know the status of the source. Then also you will have to give post-exposure prophylaxis. Okay. So what will you give? So for HIV, what will you give? HIV drugs, that is antiretroviral therapy you will give. Okay, tenofovir, emtricitabine, dolutegravir or raltegravir, etc. They are talking about. You can know this. The drug names you can remember: NRTI, nucleoside reverse transcriptase inhibitors. Okay, integrase inhibitor. So many drugs are there. Okay, guys, it looks like a 28-day oral regimen. Okay, so first we'll write here risk is 0.3%, right? And then what did you see? You have to give a 28-day oral therapy, right, of this, okay, these ARTs, okay, like tenofovir, emtricitabine, dolutegravir, raltegravir, okay, or raltegravir. You can write this. Okay, now let's move on to hepatitis B. See, even if they are talking about a condom break or something, you can talk about sexually transmitted diseases, right? So in that also you can do post-exposure prophylaxis. Okay. Now coming to hepatitis B, what they are saying, you have to give the immunoglobulins and start vaccination. Okay. Hepatitis B vaccination. For hepatitis C, guys, very easy for exam. There is no post-exposure prophylaxis. You'll only have to test this person for hepatitis C in follow-up. Okay. So follow-up testing you have to do. You have to keep testing this person that this person has not got an active disease. Okay. And you will have to, when will you do the follow-up testing? Regular 6 weeks, 3 months, 6 months, you just write like this. And then you give this person some psychological support to manage the anxiety, etc. And then that's it, guys. You have to just follow up and do testing. Okay, that's all. So here we said that the risk is what? Here the risk is 3%. That's what we saw. And there's no post-exposure prophylaxis. So you'll have to do follow-up testing. Okay. So did you get this answer? Needle stick injury you will be able to write in the exam, right? Management. Okay. Bye-bye.